Today I'm going to try to give you some insights into cannabis because a lot of people use cannabis medicinally and they specifically use it for pain relief. Now remember, THC in and of itself is a tremendous anti-inflammatory. It has 20 times the anti-inflammatory power of aspirin. So when we think in terms of cannabis or medicinal marijuana, THC in and of itself works very well. And again, it depends on the amount and the dosing and also how it's ingested, because vaping is not the same as eating. Remember, eating creates a second psychoactive 11-hydroxy delta 9 THC, which also is probably 6 to 8 times stronger than THC in and of itself. So if you're going to be selecting a strain, and it's very difficult to say this strain helps with pain or sleep and things like that, because it's truly the terpenes and possibly the other compounds in medical cannabis that offer the benefits. Again, like I said, THC helps with pain, and it's a very good anti-inflammatory. But again, the entourage effect comes from the additional terpenes and flavonoids that might be in marijuana. When you're talking about post-operative pain or possibly fibromyalgia, the terpenes you're looking for are geraniol, that's Geraniol, as well as linalool, which is also very sedating, beta-caryophyllene, and alpha-humulene. So when you go to a dispensary or you're talking to somebody and you're looking at a strain for, again, post-surgical pain as well as fibromyalgia relief, think in terms of the terpene content. This is where lab reports are critical, especially when you're dealing with legal dispensaries. They should have accompanying lab work to tell you, hey, this jar of this has this terpenes, this jar or package of this medicinal cannabis has these terpenes. So really, this is where your focus has to be. So you can't just say it's Granddaddy Purple, it's LA Confidential, it's Purple Haze, it's Strawberry Cough. You can't do that. And the only reason you can't do that is because a lot of these strains have been sort of compromised or crossbred or, for lack of a better term, polluted and diluted from their original sources, and they don't contain the appropriate terpenes. That doesn't make them bad. It just means that the names have changed because, you know, we've got purple dog shit and Barack Obama and things like that. So look in terms of the terpenes that they have or the combinations of terpenes. That's the real focus for the medicinal benefits you're looking for.